Okay, today's objectives are to provide a brief overview of the Washington State Early Intervention competencies, along with an introduction to the corresponding review tool. So I'm just going to start with a brief overview of the work that's happened with these since 2016. So the project was originally envisioned as part of the State Systemic Improvement Plan with the goal of incorporating social emotional competencies into the existing early intervention competencies that were in draft at that time. The Department of Early Learning, or DEL, Early Support for Infants and Toddlers team, ESIT, began by meeting with the DEL Professional Development team in the fall of 2016. The ESIT team held a webinar in January 2017 and quickly determined that the work should happen face-to-face. And so a large work group was convened in March 2017. At that point, there was still so much work to be done that there was a recommendation to have a small work group move forward, do edits, and then reconvene again with the large group. The small work group consisted of Wendy Harris from King County Developmental Disabilities Division, Diet Snyder from Washington State School for the Blind, and myself, and we met multiple times between March and October. And then we reconvened with the large work group in October 2017, received another round of outstanding feedback. We continued editing and finalized a draft, which was sent to stakeholders for a final round of feedback in February 2018, and the competencies were finalized in March of 2018. One important note is that a racial equity lens was used throughout the development of the competencies. This was in response to racial disparities that we identified in our child outcomes, and included incorporating elements of cultural relevance throughout the content areas, and also intentional outreach to have diverse racial and ethnic participation on the large work group. In 2016, Department of Early Learning leadership advised that the early intervention competencies should align with the Washington State Core Competencies for Early Care and Education. This would help make the connection between early intervention and the broader early learning field clear within the state system. It would also allow future access to link early intervention trainings and trainers with the Managed Education and Registry Information Tool, known as MERIT. And the early intervention competencies, through stakeholder feedback, were developed as a standalone document that align closely to the core competencies, but because they stand alone, it recognizes the specialization required within early intervention. So the 8 content areas that were in the core competencies and that were matched within the early intervention competencies are shown here on the screen. For early intervention, we added a name to the second one. It was originally curriculum and learning environment, and we added supports and services in natural environments just to more accurately represent what we do in early intervention. The Washington Association for Infant Mental Health Category 2 competencies are incorporated throughout the early intervention competencies. They're indicated with an asterisk each time they appear in the document. And this intentional linkage will support building an infant mental health informed early intervention workforce. Those competencies were kept mostly as written through WAME with a couple tweaks, but this was to support alignment for individuals applying for endorsement to, for them to be able to find those competencies easily within the early intervention competencies. The Division for Early Childhood Recommended Practices were also used as a reference and crosswalk in the development of the early intervention competencies. This framework provides a great visual of how knowledge and competencies of the practitioner are at the center to inform the services provided to families and the connection to child outcomes. I'll pause for a moment for you to take a look at this. these are some of the potential uses of the competencies. They can be used by and with early intervention providers to assess levels of knowledge and skill in each content area and identify priorities for professional development. They can be used by program administrators in writing job descriptions, developing interview questions, and planning for staff professional development activities. Trainers can use them to develop relevant training opportunities. They can be used in higher education to inform course development. And state and local agencies can use them at a systems level to develop training programs. ESIT's vision is for the early intervention competencies to serve as the foundation for the development of an early intervention certificate program through higher education and an early intervention credential process through the state office. As we roll out our statewide early intervention competencies, we'd like to share some exciting work that has simultaneously occurred at the national level. Over the past 4 years, the 7 national organizations indicated on the slide, representing disciplines providing services in early childhood, have participated in an initiative to align their competencies. So these include AOTA, APTA, ASHA, CEC and DEC, NIAC, and 03. The Early Childhood Personnel Center, which is an Office of Special Ed Programs funded technical assistance center, has worked to convene representatives from each of these organizations. They provided the most recent descriptions of their personnel standards or competency areas, and a comparison or a crosswalk was done across each of these documents to identify common areas of competence across all the disciplines. The 7 organizations agreed upon 4 common core areas of competence: collaboration and coordination, family-centered practice, interventions as informed by evidence, and professionalism and ethics. So representatives from each of the 7 organizations reviewed and presented these core competency areas for approval to their organization. And the ECPC, or Early Childhood Personnel Center, is going to create guides and exemplars of practice to demonstrate what these look like for use nationally. So I just included a brief description of each of those 4 areas, and there's links in the bottom of the slide if you'd like more information. Coordination and collaboration and coordination refers to working across professionals from other disciplines and community organizations in every facet of intervention or instruction. Family-centered practice is culturally competent practice in natural settings that involves and actively engages the family in decision-making and the provision of services or therapy. Evidence-based intervention requires the use of scientifically based evidence to inform all screening, assessment, intervention, and evaluation delivered to an individual child and family. Data-based intervention and instruction refers to the process of collecting data about a child's level of performance and designing and implementing a plan, for example, an IFSP, that is evidence-based and focused on remediating a child and family's needs. Professionalism requires all who provide early childhood intervention to have knowledge and skills in the laws, policies, practices that govern their professional discipline. It also requires that all in early childhood intervention demonstrate professional ethics and advocacy with each infant, young child, and family they work with. Professionals in early childhood intervention will also take responsibility to improve their knowledge and skills through professional development and self-reflection. There are a number of connections here to the Washington State Early Intervention Competencies, which is really exciting. So like I said, you could check out the links for more information. And I saw a question, but it went away. Let me see. Okay. And so this is what our early intervention competencies look like for now. They will likely be designed with a Department of Children, Youth, and Families logo, and with some more color and design that more intentionally matches the core competencies for early childhood education. I'm going to show you really quickly. These are on our website currently, and we will be emailing out the competencies and the review tool after the webinar today. So the competencies are a document that closely mirrors the core competencies. I'm not going to go through the whole document right now, but it has the guiding concepts for early support for infants and toddlers. It shows how they're organized and what the content areas are, and then it goes through each content area and lists the competencies. So for the rest of our time today, we're going to take some time and walk through the review tool, which we've developed, which will hopefully help you operationalize the competencies. We'll start with the instruction page, which will help explain the layout of the tool, and then we'll take a look at the functionality of the tool. So the first tab is the instructions page. There's 10 tabs in total. After the instructions tab, there's one tab for each of the 8 content areas. And then at the end, there is a summary page. The summary page will help pull the strengths and priorities from each content area onto one page, which it can be then used for strengths-based professional development planning. Each content area is designed the same, and it includes the competency, the evidence that the individual has met or partially met the competency, a notes section, and 2 sections for date, reviewer name, reviewer type, and rating. And I want to thank the Personnel and Training In-Service Committee for working with us a very last-minute meeting last Friday to give some really good feedback on the layout of this tool and what it would look like. So I'll show you the first content area, which is child growth and development. And so this is what the tool will look like for each, with a different color coding that matches the core competencies. Check my email out. Each competency, the competencies are listed along the left column. Each one is identified as either an attitude, knowledge, or skills. And attitudes are core beliefs regarding services to young children with developmental delays and disabilities and their families. Knowledge includes what providers would need to know to provide early intervention, and skills include what providers would need to do. So you'll see here, each competency has this evidence section, and the evidence is the documentation that describes achievement of a competency. As you can imagine, attitudes are difficult to measure, and so we tried to think of ways that you would be able to tell if someone has met an attitude. So you'll see for each evidence, there's a drop-down menu. I'll make this a little bigger. And so for this first attitude, which is values the wide range of children's development across individual, cultural, and community differences and respects family beliefs about health and development, we have some options here. You could try to measure this attitude in your interview process if it's a brand new hire. You could try to measure it through the development of a question for when you're checking references. Or it could be through direct observation of how you've observed this person talking about child development or about families, whether it's in a team meeting or with families, or there could be other. So we've included an other option in every single one because we know that we haven't thought of everything. So if it's something else that you feel that you could measure this competency, you could select other and explain in the note. So for this one, for example, I'll just show you how the tool works. I might have measured this with an interview question. Here I could put in any notes that I wanted to. You can see on the spreadsheet, and this idea came from the in-service committee, that it could be used for an initial rating and then later on another rating. So there's 2 sections of columns that have date, reviewer name, reviewer type, and rating. And so you could do that initial and later. We've also locked most of the spreadsheet so that the formulas don't break. but we've left this part unlocked if you want to add more columns and add additional ratings. And so what I might do is select, let's see, okay. Oh, this one, so some of these are open fields. So I might say that I interviewed this person today, here's my name, and I am going to be that person's administrative supervisor. So we gave a number of options, which were brainstormed by the in-service work group about different individuals who could do the assessment of the competencies. And that there might be different people doing different competencies, so we have this option every time rather than one at the beginning of the spreadsheet, because as someone explained in their onboarding process, they may have a clinical supervisor working on pieces around service delivery and what that looks like, for example, for a speech therapist. There could be a team lead who's a family resources coordinator who's supporting child outcomes work. There could be a peer or a mentor for different pieces. So it might not be the same person helping with every competency. There's also an option for self-assessment. So another way the spreadsheet could be used is for individuals to rate themselves, kind of go through and decide what evidence they have, and then meet with their supervisor and go through the tools together. So if we said administrative supervisor, and then I'm going to show you what the ratings are. So the options are either yes, emerging, or not yet. So a yes indicates that the competency has been met or is fully observed most or all of the time. Emerging indicates the competency is partially met or observed some of the time, or that some but not all of the competency is observed. And not yet indicates that the competency is not yet met or is not yet observed. So for this one, we'll say yes. And then I'm going to show you, I'm going to walk through one that's a knowledge competency. So one thing you'll notice is that some of these are color-coded all the way across. They're shaded all the way across. We have some competencies that have sub-competencies rolled up into them. So for this B, knowledge, they really have to meet all 4 of the sub-competencies to meet the main one, B. So the ratings that are scored in 1 through 4 will be reflected in the overall rating for B. So here's one, conditions that optimize early infant brain development. This one has the asterisk, and it's the Washington Association for Infant Mental Health competency. So if the person has met WAIM endorsement, that could be one of the ways you show this evidence. This could also be something that is learned through coursework or continuing education class. So this is where the knowledge competencies could really be something that is learned and tested. But if the person has not had the opportunity to participate in higher education or continuing education on this specific topic, you still could observe that they really understand infant brain development. So we have a direct observation option as well, and again, an other. So for this example, we'll say that, that this person had WAIM endorsement, and you would go through and we have the option for notes again and all of the other columns. And if we show this one, which is functional development across the 3 child outcomes. So this is very specific to Part C, early intervention, well, and also preschool special education. But basically specific to early childhood special education. So this one, we have some specific early intervention options like the ESIT child outcome summary modules, completion and passing that quiz. You could look at a written sample of a summary of functional performance that the person wrote in an actual child's IFSP. And then we also have a tool that is being piloted in some spots around the state, and it's called the Child Outcome Summary Team Collaboration Tool. And so when we see alignment to that tool, we've used that as an option as well. That's an observation tool. And if the person had section 3, item 1 as a yes, that could be their evidence here. So, some of these might not be right at hire, but within the first few months. So we'll say for this new staff, their team was observed doing this tool, and again, you'd put in date. And in this case, maybe that tool was done by a peer rather than a supervisor. So the last thing to mention about these is that skills, like I said before, can really only be measured by observation. The skill competencies use active verbs like explains. So for this one here, explains the range of social, emotional, cognitive, communication, physical, and adaptive differences to families and caregivers. You'd really only know that a person can do that if you've seen them do it with a family. That could be through observing a home visit, through in video or in-person observation. So here we have direct observation. Again, that child outcome summary team collaboration toolkit, which would have been direct observation, or other. And, you know, perhaps you've seen them role play it. And, you know, if there's this other option that you feel confident that it would transfer to work with families, you could explain that in the notes. A couple other items I want to mention that are in the tool, in addition to the child outcome summary, team collaboration, and WAME endorsement, are the home visit rating scale, which is a tool used to observe for quality in home visits. And some people are piloting that around the state. So we've crosswalked specific items from the home visit rating scale to some of the competencies. And also for individuals who've gone through promoting first relationships, level 2 fidelity training and certification, again, which is happening around in some spots around the state. And there are some the competencies that align very closely to PFR level 2 fidelity. As I mentioned, there is that other option because there are also other evidence-based practices that could align to the competencies. And so if you have a staff member who's certified in, and it's just off the top of my head, something like Hannon or Floor Time or Play Project, you could explain that as other. And so some of those show up, a lot of them show up in content area 4 around families, content area 6 around interactions and kind of promoting the relationship between the parent and child. Okay, so we've talked about how to use the spreadsheet. And then I just want to mention that at the bottom, let's see if I'm just going to put in a couple and say that they're emerging or not yet. And you'll see at the very bottom of the spreadsheet, it will tally for you the numbers of yes, emerging, and not yet. And so you also have a spot to put the date this content area was achieved. So once your staff achieves a yes on each competency within content area 1, you could put that date. And this is going to autofill to the summary page. There's not an expectation that any one staff would meet every single competency on their first day of hire. And so thinking about, you know, how you can use this to inform their professional development planning, I just want to show you what the, where you can put in strengths and next steps. So at the bottom of each competency or each content area, there's an open field here where you can type. And we really intend this tool to support strengths-based professional development planning. So each area has a part to, a section to indicate their strengths, and then it has a section to indicate priorities and next steps. And these will display in the summary page. The priorities and next steps can be used to identify goals for professional development over an identified time frame. So you might have a 3-month or a 6-month or a 1-year time frame. So I'm just going to show you how this works here. So an example of strengths, you do a fantastic job explaining child development to families. Would probably be more extensive than that. An example of a priority could be to review, there's a competency here around explaining healthy racial identity development. And so it could be review materials from foundational equity training and practice with a peer. Okay. And also, I want to mention that at the very top of content area 1, I'm going to use Sue Rhodes, who's sitting right next to me. You would fill in their name, which will auto-fill in the rest of the spreadsheet. So then I'll show you when you go to the summary, which is at the end, it's going to have their name, it's going to have their strengths, priorities, and next steps. And if they have if they have achieved that content area, it will be content area achieved. I wish there was some kind of like acknowledgement or, you know, confetti that happened right there, but my Excel skills are not that great. Okay, so again, I want to mention each tab is set up exactly the same way. And with that same format. And I'm going to go back to our PowerPoint. Okay, so it's time for questions. I'm going to stop the presentation, or I'm going to stop the recording. If I can do it. Okay. Pause recording or stop.